used an exploratory sequential design. So what that means is we started off with qualitative data collection. And by qualitative, I mean that the interviewer asked open-ended questions and participants were free to answer as fully and in as much detail as they chose. And then we followed that with a quantitative survey. And you can see some of the information about those forms of data collection here, but we'll go into more detail in later slides. These lovely flyers were designed by the esteemed Angela Denise Davis, and these are just an example of some of the ways that we invited people to participate. The flyer on the left is the one that we used to help recruit participants for the qualitative aspect of the study, and the one on the right we used to recruit participants for the quantitative aspect of the study. Not surprisingly, our main partner for this study was ZAMI NOBLA, National Organization of Black Lesbians on Aging. ZAMI, as Marianne has pointed out, is a karaoke word for women who work together. And it is also the title of Audre Lorde's biomythography. And those familiar with Audre Lorde know that she's a very well-known and well-respected Black lesbian warrior poet who is a fierce activist for the rights and the visibility of Black lesbians. Marianne is the founder and executive director of ZAMI NOBLA, community activist, researcher, and breast cancer survivor. And she was engaged through all stages of the study, from the design of the study, the data collection of the analysis, and the interpretation. We also collaborated with several other organizations to help with recruitment, and you can see them listed here, a range of LGBTQ organizations, breast cancer focused organizations, and a really unique partnership with Erica Hart, who is a well-known community figure, Black, queer woman, breast cancer survivor, who helped us get the word out about the study as well. So I'm going to describe phase one, the qualitative phase of the study, and I will hand it over to Dr. Dean to describe phase two, the quantitative phase of the study. So in the qualitative phase, people were eligible to participate if they were 35 years of age or older and identified as Black or African American. They had to be assigned female at birth and identify as female, otherwise known as cisgender. We made that decision because even though we know that these issues are relevant to transgender women as well, we knew that their experiences of engaging in care and with healthcare providers are likely to be quite different. And we wanted to make sure that we provided appropriate attention to the populations that we were studying. So this study was focused on cisgender women. Participants had to have a history of breast cancer or a recent abnormal mammogram. The interviews lasted between an hour and a half, and participants were compensated $50 for their time. And the focus of the interviews were on their experiences after they had an abnormal mammogram or after they had breast cancer. For data analysis, the interviews were recorded, they were transcribed verbatim, so word for word, and then they were read and coded by two different coders. And qualitative coding involves looking for meaning units in the text. So how do these different quotations or things that the participants said hold together as part of a single unit of meaning? And then you look across these units of meaning to develop themes. And there's memos that track that process. Usually there's conversations among the coders and the research team, and there's a constant comparison technique that is used to determine what those final themes are. For this study, we enrolled 15 participants in the qualitative phase. And for folks who are unfamiliar with qualitative research, they often think that 15 is a small number, but that's actually a very reasonable number for qualitative research. People usually reach what we call saturation or no new themes, anywhere between 6 and 12 interviews. So we conducted 15. The average age of the participants was 50 years old with a range of 38 to 64. Most identified as lesbian. Over half were college educated. Most were employed, about half were single and half were married or partnered, and the majority had had a breast cancer diagnosis.
So for the quantitative phase of this study, we issued a 30-minute online survey, and the eligibility included people who identified as being assigned female at birth, who currently identified as female. So importantly, we were focusing this study on women who identified as sexual minorities, but felt that those who identified as gender minorities deserved an entirely separate study. So in this case, we focused on sexual minority women and not gender minority women. women who are over 35 years of age, because we wanted to make sure these would be people who would be eligible or involved in breast cancer screening or routine breast cancer screening, and people who had either had a breast cancer diagnosis in the last 10 years or who had experienced an abnormal screening within the last 2 years. For each participant who finished the online survey, they were compensated with $25. Our target was to recruit respondents from 4 different groups. So our priority was Black sexual minority women. But as mentioned before, we wanted to be able to compare and find out what experiences were unique to women who identified as both Black and sexual minority. So we would compare that to other women who didn't meet this definition who were also recruited. And that included white sexual minority women, Black heterosexual women, and white heterosexual women. We used those same screening materials and those same recruitment materials that Tonya showed earlier. And as a result of the advertisements that were done and of the partnerships that we had with organizations like ZAMI NOBLA, there were 2,597 individuals screened, of whom 807 completed the survey. What was really great is we saw representation across nearly all United States and 46 states. Most were from California, Georgia, and New York, with a mean age of 55 years and identifying as a Black woman of any sexual orientation. That was about 37% of the sample. Sexual minority women of any race was about another third of the sample, and Black sexual minority women, which was 12% of the sample.